Good morning or greeting, everyone, from wherever you are in the world. Welcome to the HDC Chat Series, a mission-driven platform where we host global thought leaders at the convergence of healthcare and digital innovation, and of course, AI. Today, we have the great pleasure of welcoming Professor Dimitris Bertsimas. He gave me permission to call him Dimitris, so I'm going to go ahead and do that. Thank you again for accepting our invitation to join us today.
You are very welcome. Very glad to be here, Jessica.
Awesome. So let me go ahead and do a brief bio of Dimitris. The list, actually, the bio is over a page or maybe 2 pages. It could be even longer, but I'm going to read just a short bio. He is one of the world's leading voices in optimization, analytics, and artificial intelligence. Dimitris serves as the Vice Provost for Open Learning at MIT, the Associate Dean for Business Analytics at MIT Sloan, and a Professor of Operations Research at MIT Sloan School of Management. He has authored over 300 papers, mentored over 100 PhD students, and co-founded multiple analytics companies, bringing research into practice. Dr. Bertsimas received many prestigious recognitions and international awards, and we're so excited about our today's conversation. So I'm going to go ahead and get started with the first question. I've heard about you so much, and of course, through some common friends, I'm not going to name today, and we met at Hartford Healthcare Inaugural Summit, where I learned a little bit more about you and how much you contribute to knowledge and make an impact leveraging AI to solve many problems. So you also received a PhD in applied mathematics and operation research. So from pure math and analytics into the messy human world of healthcare, of hospitals and patient care. Can you tell us a little bit about your journey?
Yeah, with pleasure. First of all, thank you for the introduction. I have been in the United States for about 40 years, actually almost to the day, 3 years as a PhD student at MIT and 37 in the MIT faculty. The key objective of mine is I would like what I do in research and education to matter in the world, to have an impact. And in particular, of course, you can choose. There are many ways to have impact. I think I have chosen 2 in particular, things that improve, at least in my opinion, the human condition, and healthcare is very much in this direction, and education, because I believe education has a multiplicative effect. You educate people who educate others and so forth. And both of these are I have pursued for many, many decades, including today. Today, I primarily work in healthcare, and I also lead what MIT does in education out for non-residential students. So I have been involved in healthcare from late 1990s. And in fact, I was involved in developing a first company in 2001. It's called D2 Hawkeye. It used claims data and tries to advise healthcare claims data, and it tries to advise companies about the future costs for healthcare for their employees, as well as the quality of care. The company grew in 2009, just before we sold it, had about, the order of 30 million people a month that we process data for. And then I continued with others. Healthcare has continued to be, because of its impact. And in this process, I have collaborated with multiple hospitals around the world. The most sustained aspect of this, of course, was with Hartford Healthcare, where we met, where I have been collaborating with many parts of the hospital system. for about a decade. But many of the Boston hospitals, primarily in the East Coast and internationally, I have put a lot of effort on that. Some of it has been on medicine, on hospital operations. Some of them has been the financial aspects of medicine, because healthcare is 20% of the, at least in the US, of the national GDP. Clearly, money plays a role. How do you organize services and in such a way that the cost is more palatable for individuals and families? We have actually in 2010, I have started another company called Benefit Science that again utilizes claims data information to design healthcare policies for large organizations that mitigate some of the costs and maintain quality. So all aspects of health, it's not difficult to motivate me on any aspect of health. I think it's important, and I have engaged also many of my students. I've graduated many students, more than 100 doctoral students, and I would say a large portion of them, at least in the last 2 decades, work in healthcare.
Absolutely. Great introduction. I'm so appreciative. And that just makes me ask you a little bit more questions, but I'm going to be mindful of your time. Based on our meeting last time, 4 weeks ago, you were featured leader at Harvard Healthcare. This is not to minimize your collaborations with other hospitals, but what stood out to you about integrating AI into clinical practice? You mentioned financial operation. What is that? What is the impact that stood out when it comes to clinical practice?
I mean, in the end, the purpose of healthcare is to help people. That's objective. You don't have healthy people going to hospitals. You have people that are not so healthy. So being able to help them, I believe that with the availability of data in electronic form, in multiple formats, we have images, we have reports, radiology reports, nurses' notes, we have all this data, and AI has advanced. I think it's a fantastic opportunity. I believed a decade ago when I started doing it, and even more now, that it can make a material difference on people's health. You can detect diseases earlier. You can prescribe treatments that are more effective, that take into account global effects. And I have pursued this effort both in research, but then also with implementation in hospitals quite strongly. At Harvard, which is my longest collaborator in this area, we currently are engaged in, we actually have a company together called Holistic Hospital Optimization, H2O, that is primarily on hospital operations, how to optimize length of stay, how to optimize the blocks, operating blocks for hospitals. But we are currently engaged, myself, my students, and many people from Harvard. We have about of the order of 80 physicians that we collaborate in 15 projects. So it definitely has, I mean, in order to make an impact in healthcare, you have to engage in a critical way the people who actually apply healthcare in the hospitals. These are nurses and physicians. And like today, for example, in the morning, I had already 2 meetings with some of my Harvard friends about some research we're doing in one in neurology, the other one is in cardiology. So it's an exciting world. The field has advanced, AI field has advanced, and there's also increased appreciation by the world, in particular by the medical community, that these things can be useful. And if you could combine this with a friendly leadership that exists at Harvard Hospital, in other places as well, but Harvard, I can say from experience, not hearsay, is you have a winning proposition, actually.
Interesting. You mentioned about healthcare being very data intensive, and I'm going to shift back to your background in math and mathematics and operations. What type of models or AI tools and techniques you've been using and have been showing some success and making an impact in the different projects you've been undertaking?
So my expertise is AI, the use of multimodal data. Multimodal means images, uh, language, tabular data, genomics, and time series of these, plus optimization. How do you design optimally things in order to optimize some objectives in healthcare? So this has been over my career of about 40 years. I have applied these areas in many industries, in finance, in transportation, in insurance, in law, in multiple areas. Healthcare, quite dominantly. I already talked to you about some of these things. And to give you two examples, just to demonstrate the type of things we do. In one case, the use of optimization, for example, the hospitals, a large hospital system like Hartford Healthcare, a sizable portion of its revenue comes from the surgeries the doctors execute. And the question is, can you optimize who does what, when, in what room, with what capabilities, in order to optimize cost, to optimize the use of rooms, to add more capacity in the system, so that you can perform more surgeries. This is a use where using an example where optimization can actually make a material difference, improving revenue, improving efficiency, and overall resulting in better healthcare. And then on the AI, I'll give you another example. We have built a system at Hartford Healthcare System and many other hospitals in the world where we try to predict length of stay of patients and have also early warning indices if somebody deteriorates health, how to alert the personnel prior to having a crisis. And in both cases, we have found, with close collaboration with our friends from Hartford, where we found that it improves length of stay significantly, typically cutting it down by half a day to 3/4 of a day, a very significant effect because it improves revenue, it improves costs, and so forth. But also allows a large system like Hartford Healthcare to increase its service to the world because if the people stay there shorter times, there will be more people coming because this is a high throughput hospital system. In the second case, we use machine learning, AI, where we utilize information from various sources, electronic data, medical records, doctors' notes, images, and so forth. This hopefully get a sense of the types of things that are relevant here.
You talked a lot about data. Is there any type of data that gives you a lot of hard time, or a type of data that you are missing, you would like to have when building these machine learning or AI models?
Yeah, take an image, for example. Images are extremely heavy in terms of like a tabular data could be the whole tabular data would be, let's say in the megabytes. When you have images, is in the multiple gigabytes. We're talking 2 orders of magnitude higher. So we actually have developed, with help from the Hartford Healthcare System, we have developed. We have servers, we have GPUs with very high memory capability to be able to process all of these things. So all my students, for example, have access to the servers. In fact, we added further servers to process this data. An area that would be fantastic to also have, and it's fair to say that based on the decades collaboration, we have access to a lot of data that has made it possible to advance the science and the practice, because we are very much interested in that. The area that would be even something to aspire in the future, to add more genomic information. Genomic information typically exists in laboratories, in research institutions. It's not so much in the practice of medicine today. It's not zero, but very little. So, and because I do other work with other institutions, the Broad Institute, for example, at MIT, where we use genomic information, it would be fantastic to also combine genomic with electronic records, with images, with notes, and so forth. This is not as prevalent in the medical system today, the presence of genomic information. It will take us some time to get there.
It is, to my limited knowledge, that genomics is being collected heavily in other countries, especially in the Middle East. And I think I had the honor of interviewing somebody from M42 and G42, where I'm sure you're familiar with that they're working on collecting a lot of genomics in that area. I'm also aware that you've been part of a lot of international collaborations and partnerships. Can you share some of the examples of cross-border project in this convergence of AI in healthcare?
Yeah, multiple. In addition to the US, we work with Apollo hospitals in India. This is the largest. It's a private hospital system. We have 74 hospitals around India, arguably one of the highest quality providers, healthcare providers. We have worked on a variety of topics, some similar to what we do in the US, some different. We worked with two large hospitals in Greece, where I come from. We have ongoing collaborations and discussions with one of the largest systems in Europe that have arguably, is the largest in Germany and in Spain. And we have emerging collaborations with the Middle East as well. So, that's the aspect of the impact. Healthcare is universal. Humans, although might be different from geography to geography, what we have found is that models we create in one geography are can very similarly be applied in other areas. For example, we created the length of stay model at Hartford System, the 7 hospitals. Then we took some of these findings with some adaptation, but not brand. It has worked very well in many of the hospitals in India, in many of the hospitals in Greece, and so forth. So it is my hope that this will continue, that insights from one geography can affect and help others. In fact, if you have more data and when you see that the methods developed in one place work well in another place, this increases your confidence that what you are doing is correct. That is, it has broad applicability, it's robust, and so forth. So I actually very much seek these collaborations because they help, not only help the new place, they also help the other places because the algorithms can improve, becoming more robust as you have more data.
This is really interesting. Thank you for sharing that point. I was under the misunderstanding that a model that you would develop here in the US and you move it to a different part of the world because they have different variables or different circumstances, that you would need a lot more work to be able to adapt that model to that region where you're at.
There's some adaptation is needed. I'm not saying that exactly the same, but the adaptation, humans are fundamentally, there's a particular, there are differences, but on human physiology and so forth, my observation, this is not my opinion, it's a matter of fact. I have observed that adaptation is needed, especially dietary cultures, and so forth. Prevalence of diseases, for example, diabetes is far more prevalent in the Middle East than it is, for example, in Europe. But I have found that the differences are not so gigantic as one might have expected.
Thank you. We talked about adaptation, and many health systems outside the US, they operate under resource constraints. How these models or AI framework be adapted to low and middle income countries?
Yep. So the beauty of this some AI systems applied in medicine is that they use data. So if the data is available, the incremental cost is not so substantial. That is, We have started a collaboration with Morocco recently, where I believe you are coming from.
Yes.
So, I mean, it's not exactly that, this is not a well-resourced hospitals over there. Yet, this can be, my key objective is to have impact in the world. The monetary, financial considerations are present because if you don't have appropriate money, you cannot be successful. But it's secondary, I would say. So I would say you can adapt the advantage of these methods. If the data is there, you can adapt it in a way that algorithms, not humans, are involved to run. You need some humans to help, but it scales quite nicely, I would say.
You start talking about data, and my beautiful country of Morocco is investing a lot of infrastructure on data center, electronic health records all over the hospitals in the country. But there are other countries where the data is not available, or they don't have the means or the knowledge to be able to capture that data. Any recommendations? And as you said, health and healthcare is universal, and we don't want to leave any country behind. So what are your recommendations for areas or countries where they want to jump on that, but they don't have the infrastructure?
Yeah, I mean, of course, this is a serious matter. I mean, you need to have a system for electronic medical records. It doesn't have to be the systems we use in first world countries, which are pretty expensive.
Right.
But I take Morocco as an example where I have some experience. A hospital in a recent hospital that started in a university hospital in University Mohammed VI in Bengria near Rabat. They built themselves and they hired engineers to build themselves an electronic medical record system. So I think that's critical. That is, if you are interested, I mean, maybe you can build it yourself. It might not be the best system in the world, but to have something that you collect data and therefore you can apply AI can be done. I have experienced. I haven't done it myself, but I have seen my friends in UM6P. This is the Moroccan university being successful in launching an electronic medical record system that in about a year and a half at a modest cost, not at numbers that are prohibitive. So I think it's feasible. I have seen one example from your country that this is feasible, affordable, and if you combine it with AI, you can go a very long way to success. I also want to say it's not only other countries that are, the US is a country of differences. There are parts of the United States where the infrastructure is not as high as you think. That is having the ability to have electronic medical records that are inexpensive. I think it's a goal of mine. And because you cannot do AI without data. I mean, if somebody claims that,
Yeah.
it's not. So
both in agreement.
Yeah, so I would say, of course, there is room to grow, but to me, key here is that a decision by the governments, by the leadership of hospitals and so forth, to invest a little bit in human capital, local human capital, to develop these systems themselves, or to get, and this is something I aspire to work on it, to create an inexpensive system that can help environments that are less resourced than first world countries.
I'm going to have a follow-up question. UM6P is a great example of of a leadership investing in the entire well-being of the country, and the hospital that you're associated with in Benghazi, close to Marrakesh. That leads me to asking, based on your experiences and collaboration around the world, about this leadership buy-in. I know a conversation is about AI in healthcare, but if there is no buy-in and support from top down and providing the resources, you and I would not exist. So how is that, if you can elaborate a little bit more based on your vast experiences?
Yeah, I'll take the example of of Morocco. I have over the years of the order of 15 years collaboration with one of the most significant companies of the country, OCP, and its chairman, Dr. Mustafa Terab, a personal friend of mine. Leadership is important. That is, there aren't as many places in the world where you have you have a very successful company like OCP, for example, that invests in the welfare of the country via the universities, via the hospitals, and so forth. And I've seen close and personal because I've been involved with UM6P from its very beginning, when it was just a piece of land, no buildings. I've seen it, the gigantic success, and also its current president, Hissam El Habti, also very visionary people who have this can-do positive attitude and the commitment to help the country, not only the company or themselves in a way. That's inspiring to see, and to the best of my abilities, I committed my help to help them in their objectives, because it's the right thing to do. I wish more countries, more examples follow this example. It is an inspiring example for others to observe and perhaps imitate.
That was a key word that I heard is visionary, and you mentioned two great visionary people and the system that you're collaborating with, which is the president of UM6B, Hisham Al-Habti, and chairman of OCP, Mustafa Tayyab. Now I'm going to shift through this visionary leader to education and universal AI, because that's really extremely important. These vision and visionary are supporting not just building buildings or just programs, but nourishing those initiatives. And you recently launched the Universal AI initiative. What is the vision behind this program, and how do you see it transforming healthcare training and practice?
Yep, I have told you that I have been at MIT 40 years. MIT teaches about 11,000 students. That's the current population every year. So it teaches about 1 in a million. So it teaches basically very smart people. So I accepted the job of Vice Provost for Open Learning. Open Learning is an organization of about 200 people that aims to educate the world. My vision is to educate, not only in AI, but in everything, 1 billion people, 1 in 7. So, and to achieve that, you have to create content that is not as mathematical. It's more real world data. People can run codes and so forth, but not necessarily program them or develop them. And Universal AI is what I have started last September, and it's about to launch next week, actually. So the idea would be to offer AI to a variety of organizations, not only healthcare organizations, many organizations, high schools, 2-year colleges, 4-year colleges, hospitals, medical schools, companies, for people of all ages, backgrounds, geographies, and so forth. And currently we are doing it in English, of course, because that's the first time, but we are also working in automatic translations, so can reach many people in the world. In mobile, in Africa, for example, only 10% of the people have a computer, 90% don't, but everybody has a cell phone. So if you are able to transmit content that is in your language, in mobile, in an accessible way, I think you have a higher chance of making an impact in your life, which is our aspiration here at MIT. So we have worked pretty hard, the entire organization, to produce this. We are also doing it in other areas: biology, health, energy, the climate, and manufacturing. This is not, the others are not AI are areas. Now, particularly on healthcare, in fact, we just finished a pre-pilot this summer with Harvard Healthcare. We had about 100 learners that took some of this material that we have built. We've learned many things, and we're about to launch in several organizations, about 20 of them. Some of them are healthcare organizations, hospitals and medical schools. The idea would be that to educate medical personnel, students, nurses, doctors, healthcare administrators, and so forth, in the art and science of AI applied to health in ways that they can understand and be helped with. I think this is a particularly important topic because if you look at medical education in the world, the presence of AI is very little. You know, people know a little bit of regression, maybe. And also the model has not changed from the last 100 years. When John Hopkins, for example, started developing the model that currently is an example of how modern medical schools work and education works in the medical profession. Of course, AI did not exist at the time, but it hasn't yet found its way to the main curricula and so forth. So it is my aspiration, primarily because I care about healthcare, is to also make this available, universal AI, to educate medical personnel. For example, at Harvard Healthcare, before this universal AI, which is an online offering, I have actually given lectures twice, 10 lectures over multiple weeks to personnel at Harvard. There were about 100 people in the audience because there was the capacity of the amphitheater, about 200 online, roughly 300 each time, to educate about the art of the feasible in AI and health. And this resulted in a very enthusiastic positive response that resulted in having 80 collaborators, physicians and nurses today. It's not that they understood the depths of AI, but they understand what it can do. It created interesting aspirations that they are not wasting their time and so forth. And then intelligent people who are more knowledgeable over time greatly contribute. I consider this an unmitigated success. And in fact, this success at Harvard led me to, this and few others, led me to envision educating using AI, a large collection of people. There's a great need on that, in my opinion, great need as we speak. And I hope this could definitely contribute in helping fulfill that need.
This is really important and interesting and very timely. When I joined Quinnipiac, this is a very small contribution compared to your vast impact to practice in science. I developed a course, AI and Analytics in Healthcare, and since I have a joint appointment with the medical school here, of course, medical students are taking that course, and that's one of the reasons this platform, mission-driven platform, started, and inviting great global voices such as yours to benefit both students, professionals, and any other key players. I can't speak on behalf of the university. I'm speaking on behalf of Rachida. Whether it's our medical students or professionals, we all need some level of literacy, of AI literacy, to be able to understand the impact, whether you're doing, if you're on the AI side, you need to understand healthcare. Otherwise, you can build the best model, but it does not apply. And if you're in the realm of medicine, you have to understand the power of AI and how you can leverage it. Going back to this, to education, because it's really at the core of what we're doing for the future, rather than just let me make the best model and make a buck out of it. It's really investing. And that's really what I love about this conversation, is how you are envisioning, how you're working towards and launching this universal AI to benefit people, whether from US, Morocco, Greece, South Africa, wherever they might be. How is MIT particularly and reiterate to the audience, you're Vice Provost for Open Learning, Associate Dean of Business Analytics at MIT. How is MIT, or is it Open Learning, or is it AI, University AI, collaborating and positioning itself as a global leader in responsible AI for healthcare?
So the way we do it in open learning
Okay.
is as follows. So we have launched a new platform called Learn MIT EDU. It's open to people.
Okay.
So we then have a relation with an institution, let's say Harvard Healthcare, a medical school. I mean, maybe your university. I mean, these are possible examples. So then all people will have that have emails with Harvard Healthcare or the Greek universities and so forth, a particular Greek university have access, and they have access. In addition to many of our offerings, the vast majority, they also will have access to universal AI materials, namely foundational modules, and then verticals. Some of them are in healthcare. So the idea would be they have literacy, and they start deepening and in addition, we start with MIT material, but we are open to utilizing the collective knowledge of the world. In the beginning, an educator like yourself could contribute, assuming, let's say, your university has a relation. You, as an educator knowledgeable in this space, can create your own modules and so forth for your own students, part of Learn. But then some of the best things that everybody does will then be part of the universal AI, so that everybody does. So the collective intelligence of the world helps the world. It's not just MIT. So that's how we envision, and quite a bit of it is free and open. But because we want to maintain financial viability, the entirety maybe not, there's a fee involved, but many of the learners can get a sizable portion that is free for them, and then advance their careers. It could be also, nurses or doctors could use it to get increased literature in AI. But I hope I make sense of how we are envisioning it.
This is a great initiative, and I hope we find a way to collaborate between universities and, of course, between systems. I'm going to shift quickly, well, still within innovation, but I'm going to add entrepreneurship to it. You co-founded more than 10 analytics companies, and the purpose is to solve complex real-world problems. What motivated you to make that switch from academia, from research, from teaching, to translating all of that into entrepreneurial practice oriented ventures?
I mean, my observation has been that academics, this is not a 100% statement, but it's by and large, a large portion of academics do good work, dedicated work that never is applied in practice. So my objective in life is to have impact in the world, my life to matter. So I do not believe, I mean, of course, you can write a paper and so forth. Some people would benefit. It's not that it's zero value. I mean, that's not correct. But it's very hard for the world to change with scientific papers alone. So I have oriented my work in such a way that when I started working on a topic at MIT, I asked the question, suppose we solve this problem, is something going to change in the world? Very often, the answer is nothing will change. But I would like to work on things that actually, something changes. And the way to achieve that is, let's say, for example, we have created a transportation system for transporting children to schools. We publish papers, we got awards, we work with Boston Public Schools. Then I start a company that is, if I left it there, it will die. But now we have a company, it has software. Many cities around the United States use it. Children are being transported. Something changes in the world. Let's take healthcare. So I could, and we wrote papers on length of stay, on nurse optimization, all of the stuff I told you. I mean, if I did not start a company that has software that people can use, the idea will just die. So, and I think these things are useful, at least in my humble opinion, of course. But late evidence suggests that I'm not wrong. But if you implement it correctly and so forth, something changes in the world. You have, millions of people who could benefit from these technologies. So my main aspiration, objective in life is similar to what I do in education. I would like my life to matter. I would like to contribute to the world, and we all live, not too long. I mean, we live, very finite lives, and as the years pass, it's even less finite in front of us. So I would like to make certain that what I do affects positively the world. I engage young people to that so that they can continue even after I'm gone. So and this increases, of course, my personal happiness, my sort of sense of self-worth. And because I have now more experience, having done it multiple times, the N+1 company is easier than the Nth one because, I have experience, I have more resources, and so forth. I hope I make sense.
Absolutely. You just said N+1, it's way much easier. How about some sort of advice to contributors in the field, in the world of research, and to make that leap from somebody who wrote an a research or did a study that has a great impact, but it's just kept on a manuscript. What support, what thought that transition it from best winner manuscript to let me help the transportation system in Boston?
You have to have, first of all, you have to care to have impact. Not say you care, to actually care. That's number one. Number two, not every academic is capable of that. Most academics, the skills needed, at least in my experience, the skills needed to become a successful academic, a successful proposal, is a set of skills. You need to have creativity, communicate well, and so forth. The skills to create a successful company are different. You have to be able to live with the ambiguity of uncertainty. You have to be able to say, academia has a sense of perfection sometimes. We need to do, good luck if you have this mentality in the real world. I mean, you have at some point to make, for the broader good, you have to make basic compromise with very good to excellent, but not perfect. My advice would be, first of all, to think very carefully on where to allocate their time. I allocate, so I would like, before I start working on a topic, I would like to make certain that if I succeed, something changes in the world. And as I told you, in my early decade as an academic, I did, I think, creative, interesting things, but nothing changed in the world. And then I recognize I have to change the way I think about these things. And this is what I have done. But it requires commitment. It requires to think more broadly about your mission in life, what you want to do, and so forth. That's what I have found to be truthful for me. I'm not saying it's a universal truth, but it's my experience.
Well, thank you for sharing that. It takes more than just a technical aspect or financial aspect. There is another entrepreneurial aspect that you just shared. You're caring about something that really truly matters to you beyond the accolades that makes it keep moving forward. Every single project, I'm going to go back to designing AI systems for them to be applied and applicable, whether in practice or otherwise. There has to be an aspect of trustworthy AI. It doesn't matter who you work with. How do you design those systems that physicians or other can understand and trust?
Yeah. So first of all, everything I've done in healthcare was in collaboration with physicians. It's not like I was sitting in my office with a team and then let's now imagine something and so forth. It has been meetings after weekly meetings for years on topics and so forth. In the length of stay, as an example, I have met with a gentleman named Dan Calbert, which is a physician at head of the logistics center at Hartford Healthcare, and about 6, 7 other physicians weekly for 2, 3 years. So we had constant feedback. For example, in the end of the day, they are co-designers. We wrote joint papers. So the initial trust is because of the joint work. They were themselves part of it. And I have observed that it's when you make a presentation on something, if the physician introduces, not an academic who is not, it's a very different level of trust.
That's
So,
right.
and I have followed that paradigm, definitely in healthcare, but also in other companies that I'm involved. I would like to involve the actual users in the development. First of all, it improves. That's the other aspect. It improves human experience. Humans, especially intelligent humans with a lot of experience, can definitely help. But also, it helps in the trustworthiness. That is, for example, when when a colleague says to the other colleague, "I've used it and I have found that," not me, they. I mean, it's a different ballgame. I mean, we are talking. You know, a different level of trust. Now, at the same time, we are very careful on being HIPAA compliant, on making certain that the data does not go to inappropriate places and so forth. But this is more mechanistic way of doing it. Important, but the key aspect is the human trust that I have found develops by collaboration and then involving them in the dissemination of these systems.
This is really interesting, and a lot of papers did talk about it, but you're providing an actual real example of moving or not moving forward. To share a small experience, I'm working, or we're about to submit a paper about operationalization of AI. I started initially by myself, and then a colleague of mine across the hall, a medical doctor, she looked at it and she had a lot of input because she looked at it through the lens of medicine. Then we struggled with one section, and then we invited on board a JD, also a faculty here, and the paper moved drastically from being just technical and AI centric to encompassing law, the ethical part, the medicine, and it just became so much richer. Yes, it's still manuscript, but you're allowing us to see how it actually can be applied if you don't have that trust moving forward. I know I took a lot of your time, so I have one final question, if I may.
Of course.
If you could design one global AI moonshot, I'm not talking about J.F. Kennedy, what would it be and why?
Well, I have already, I have created universal AI. No, when I say I contribute, I led it, but many people who have 33 faculty members at MIT who contribute. So our moonshot is to reach 1 billion learners. I mean, is to be able to educate a significant portion of the world in AI and to become the key information in AI in the world. I mean, there's no doubt in my mind that AI is going to influence. It's already influencing the world. It's going to influence even more. Jobs will be different than today, and so forth. And many people talk about AI. They don't know what it is. People think that AI is ChatGPT, but it's not. So my key moonshot idea is universal AI. It's also the first objective I have put forward in the leadership of MIT when they selected me. I would like to educate 1 billion learners in the next decade. I would say that's the ultimate moonshot. Maybe even more, but if I succeed in substantially toward this objective, definitely my life mattered a little bit.
There is no doubt you're stopping at this initiative, I can foresee with the limited knowledge of what you do, there is no stopping in your initiative, empowering and sharing things that matters to better improving the human conditions, as you said, and improving education across the globe. Thank you again so much for
Thank
this
you.
great, enriching conversation, and I hope to see you in person in another event very soon.
Very nice to see you and discuss, Rachida. Bye-bye.
Thank you.
Disclaimer. The views and opinions expressed in this podcast are those of the presenter and do not necessarily reflect the views or positions of the organization or entity represented by the presenter.